All right. Welcome, everybody. My name is Nicole Creamer with Blue Cross and Blue Shield of Nebraska, and with me today is Jenny Robinson. We wanted to give you a quick snapshot of the individual ACA plans that Blue Cross and Blue Shield will be showcasing effective 1/1 of 23. All right, a couple of quick highlights. I do want to point out that Jenny and Clancy are your service team. They are here to support you and answer any questions that you may have. In addition, we are adding a new role, which is our individual market sales associate, Teresa Clafter. She is going to be supporting you and your customers, and I'll talk about that a little bit later. First of all, we do want to highlight that we put out a lot of member engagement pieces for our launch back into the ACA market. I would encourage you to go out to nebraskablue.com/brokers, check on the broker marketing materials tab, and you can order any of the documents in front of you. That first piece is strictly educational. That's this document right here. There are clarity pieces and how to pay for your premiums, health savings account information, health savings account limitations, max limits, max out of pocket, etc. Those are all pieces that you can order through our online form and send out to your clients. For sales pieces, we include the brochure item here, which will outline all of the plans that we have on market this year. In addition, there's a flyer that compares our Armor Health product along with the ACA product side by side. So when you're positioning that with your clients, you're looking at a couple different options. Plan options. So as you know, Blue Cross and Blue Shield of Nebraska is going back into the ACA market. This is a quick snapshot of the different plan options that we will have available beginning effective dates 1/1 of 23. There are 3 bronze plans with 1 HSA, so a total of 4, and 2 standard plans. Silver plans, there's 3 silver plans, no HSA, and 1 standard. Gold plans, we have 2 gold EPO plans, no HSA, and 1 standard. Now keep in mind the standard options are pretty much synonymous across the board with a few differences in network and prescription drug programs. Here's a quick snapshot of the different plans that we will have available out in the market. Our HSA bronze options start at $6,000. We have a 0% coinsurance option, and then of course a primary care visit, and then one that specifically supports mental health individuals. So when you take a look at that, what we really tried to do, you guys, is present broad options to give you a variety of options to align with your clients and what their specific needs are. The 2 standard plans on the right, as you probably already know and have discovered, there are going to be standard options out on the marketplace this year. Since we are participating on exchange, we will have standard options as well. When you go down to the bottom of the plans, this is where your big differences are, other than networks across the board from carrier to carrier. But on the standard options, there's a 4-tier prescription formulary, where the regular plans have a 6-tier prescription formulary. The silver options, we do have 3 silver options that are coming to market with 1 standard option for a total of 4. Again, we tried to adjust those to appeal to your different clients with a 0 deductible option, a primary care physician copay at 0, and then a mental health office visit copay at 0. These are all outlined, you guys, in the brochure. So if you have not ordered brochures, get them ordered so you have them. They are ready. They are out on our nebraskablue.com, so you can order them today. And then again, the same differences on the standard option between carrier to carrier is that standard copay. It's a 4-tier for pharmacy, where it's 6-tier on our regular options. The gold options, there are 2 that are going to market with 1 standard for a total of 3, $1,500 deductible, and then a 0 deductible option. And again, same conversation on the pharmacy side as well. I'm not going to spend a lot of time here. I think there's probably more information that you're interested in as we go forward. Network has been a challenge for everyone. One thing that I do want to call out on our network is not going to have Blue Card, so they do not have coverage outside the state of Nebraska. Our plans are EPO plans. As you can see, if you look at the map there, everything is area rated by zones. You have 1, 2, 3A, 3B, and 4. So keep in mind, Blueprint Health which is CHI focused, but it includes Children's Hospital Medical Center and Boys Town National Research Hospital. That's in areas 1 and 2, so your bigger metropolitan areas. And then that little pocket, Kearney, Grand Island, Hastings, 3A there right in the middle of the state, also has Blueprint Health. I do want to highlight that going to market this year, we really wanted to proceed with caution and be a little bit conservative. It's easier to add benefits later on than to add something and pull it back, which is one of the deciding factors with us adding Network Blue or not. So we did not have that nationwide Blue card on our plans. Now you move into areas 1 and 2, they also have options with Premier, Select, Blue Choice, which includes the Nebraska Methodist Health System, Nebraska Medicine, UNMC, Children's Hospital, Boys Town, and Bryan. So those are the 2 primary networks in areas 1 and 2. Area 3A is Blueprint Health. And then out in the middle, our greater section of Nebraska and the Western Panhandle, areas 3B and 4, right here, we are using Network Blue. So that's our statewide network, which is the most robust, which covers 98% of the doctors and non-governmental acute care hospitals throughout the state of Nebraska. You're probably wondering how we're going to handle out of network when they're outside the state of Nebraska. It is emergency services only, since it does not carry that blue card. When you look at your contiguous counties in the metropolitan area, that's a little easier to solve, because when they go over to Iowa, there are some health systems that are part of our contract. They will have coverage. So in Council Bluffs, it's a little bit more challenging out west. I'm going to pause there. Were there any questions? I don't see any. We'll keep moving. All right. One thing that I do want to highlight as well are commissions. We are going to be paying $20 per member per month, no cap. So if there's 5 people on the policy, we pay for 5 people on the policy per member per month. In addition, we did launch our bonus program. You can earn up to a $125 bonus, that is per member per year. I do have flyers on that. Feel free to reach out. We'd be happy to send that out. There's tiers on the broker bonus. Tier 1 starts at 25 for 50 members. As soon as you hit 150, it bumps up to 50, and 250 plus is 125. It looks like we do have some questions. So will Sioux Falls and Yankton, South Dakota be in network? I see your question there. Only if we have direct contracts with those providers. I would say this first year it's going to be conservative. There may not be very many outside, so mostly urgent care and emergency care. Where do you find the brochures? On the marketing side, not seeing them in the marketing tab. It should be on the order form. So Stephanie, go to the order form. If you don't see it, let me know and I will make sure it's out there, but they have been out there. Question for Blue Cross. Did you say anything outside of Nebraska is emergency only? That is correct, Mark. These are EPO plans. So they are inside the state of Nebraska only, not outside the state except for emergency services. I would highlight that our Armor Health product does offer the National Blue Card program and our Network Blue. So it does have a very robust network. If somebody is adamant, or maybe they have a student that needs coverage because they're going to another state, I would encourage you to consider that option. Otherwise, coverage would be limited to the state of Nebraska. Now, we do have telehealth benefits available, so they can still use telehealth. So if they get sick and have a cold or what have you, or it's a small issue, they can use telehealth services. Do emergency services include urgent cares outside the state? My understanding is that it is emergency care only, not necessarily urgent care. I'll get clarification on that. And Jenny, if you know differently, let me know. Pop in. Network Blue is not going to be in all areas.
Nicole, the way I understand it is it's emergency room only.
Okay,
No,
that's how I did it. Okay. Thanks, Jenny. I appreciate that. Network Blue is only going to be available in areas 3B and 4. So that central part of the state and out in area 4. If you look on the screen, it's this area right here and here. So that's where Network Blue will be. This is where you're a little bit more limited. 3A only offers Blueprint Health. And then areas 1 and 2 offer both Blueprint Health and Premier Select Blue Choice. So that's heavily weighted either Methodist Health System and UNMC or CHI systems. And I think we've covered all the questions so far. All right, moving along, back to those commissions, $20 PMPM, no cap. There is a broker bonus that's going to run year long. So keep that in mind. It is a year-long bonus. We are both off and on exchange. So members can enroll off exchange on our enrollment portal. Our enrollment portal is going to be an EDE portal, which is enhanced direct enrollment. I'm going to pause for a second. I saw another question pop in there. So if they have Network Blue but have to have surgery at Bryan Health, would they be covered? Yes, because Bryan Health is included in Network Blue. So that answers your question there. You're welcome. Okay, back to the EDE enrollment portal. We are really lasering in on focusing and having a very streamlined process. Now, one thing that I do want to highlight, it doesn't matter where you submit your applications, whether you submit the application through healthcare.gov or whether you're using Health Sherpa, we're going to receive the enrollment file. The EDE portal is fully integrated. When you log into our portal, you will be able to see your ACA members in your broker view. So you can help triage a couple different things with them. You can help them with their financial status, their membership status, the application status. That'll all be populated in the broker portal. It'll also tell you if they're missing a payment or terminated or at risk of in their grace period, things along that line. So keep that in mind with our portal. And again, it doesn't matter how you submit it. You're going to have access to that book of business in the portal. We will be launching it soon. It will be on the BBP, the broker business portal. So if you do not have access to the BBP, I would encourage you to reach out to broker appointment. I do see another question. If a broker has 250 Bella buttons, would you get paid? I have not done the math on that. The $20 is per member per month. That's your straightforward commission. The bonus is per member per year. So I would have to calculate the math on that, but it is a belly button payment. It is per member, both on the bonus and the commissions monthly. So broker portal is where you see Armor. So yes, so today where you see the Armor Health, you can see the screen there. When you go to the Armor Health applications, you have your applications here, you have your re-enrollments here. You're going to see a brand new button pop up here. We will be sending out a communication to you, letting you know once it goes live. We are keeping track of who is appointed and ACA certified, and those are the individuals will automatically make sure you have access to that portal. So as soon as you get your certifications done, we will pull that off of healthcare.gov and make sure that you are loaded in the portal. Just to give you a quick snapshot of what the BBP or what the enrollment portal looks like for healthcare or for ACA products. God, I'm stumbling here today. This just gives you a quick glance of what it'll look like when you log in and you want to look at different applications for your members, help them out with changes, SEP changes, and so on. Very straightforward. If you're using Health Sherpa, this probably looks very similar to their portal. You'll have the option to either enroll direct without ACA or with ACA benefits. And you can do that all fully integrated through our portal. But as I mentioned before, you don't have to use our portal. We want you to use what's best for you to work with your customers. But it will offer plan cards that shows the full lineup of the different plans. This kind of gives you an idea of here with the different options. You can enroll direct or on exchange through our enrollment portal. In those plan cards, you'll have shopping options very similar to what you're already accustomed to. You can shop by plan level, by benefits, by premiums, and so on. All right, I do see a question. Is the bonus such that you will receive the highest bonus on 250 plus and not on the first 249, or is it retro back to the first member? Let me double check. I believe it is going forward. They are not retroactive, so it'll be going forward. So the first 50 to 149 will pay 25 per member per year. 150 to 249 is $50 per member per year. As soon as you hit 250 plus, it's 125 per member per year. All right, I think we did that in record time, you guys, with 15 minutes. Are there any additional questions out there that I can help you with or answer since we were coming back into the market? Will an Omaha zip code be able to buy a network plan, a network blue? No. Omaha zip codes will have area Blueprint Health and Premier Select Blue as their options. So in that area 1 and 2 right here, it's going to be these two options here, the Blueprint Health or the Premier Select Blue Choice. I do want to call out that if you're looking online to see who's in network, it's under our regular provider finder. Make sure you leverage the HB. So Blueprint Health you're going to see out there. You're going to see Premier Select Blue Choice, but you want to make sure that you're looking at HB. That signifies that it is an ACA product. Same for Network Blue. Will we be able to take binder payments and set up auto pay for clients? Yes, you will be able to do that. Also have access to ID cards on the portal. We will not have access to ID cards on the portal in our first round. We are working to get that fully integrated, but I would not count on that on day one, but we hope to have that very soon.
Hey, Nicole.
Yeah.
Hey, this is Nate. Hey, my phone cut out there, but when you were talking about the bonus program, did you say, so if I have, it was Courtney's question, on January 1st, if I have 250 members, I was told that you get the 125 for all members. So it's actually taking a snapshot of how many you wrote during that quarter, and that's basically setting your bonus criteria.
I'm looking at the actual flyer, and it says tier levels are not calculated retroactively. So it would be going forward.
So the way we took that was in, let's say, March, I get to 250 members, or excuse me, not March, let's say Q3, I get to 250 members. You're not going to retro pay on all those ones prior to you hitting that point. But as soon as you hit that, at that snapshot of the end of the quarter is what you're going to be paying the bonus on.
We'll start as soon as you start. Okay, I see what you're saying. Okay, hold on, let me look.
Because I think that the big question is, if I'm going to move 250 of my members to blues, hopefully I'm getting the 125 from day one, and not, or on all of those members, not just the ones above and beyond that. So I think we'll need clarification, because my understanding was if we hit that, in that first quarter, then yes, that they would pay 250 on all, or excuse me, the 125 on all of them.
I will double check. I'll confirm for you, Nate, so you can push that information out. But I do want to call out that the broker bonus is year round. It's not just first quarter. Okay, all right. But let me clarify it for you and make sure. Yeah, I'll find out. Okay. And we're having more questions about ordering on the order form where you can order materials. I will go out there and confirm. And take a quick look. All right, what other questions do we have? Hey, and you were right. It doesn't look like they're out there. If you want to send me an email, I will order them for you and get them out to you. And it's at Nicole.Creamer, CREAMER, at nebraskablue.com. All right. Will the premium payment option be monthly electronic funds only? No, they can send in a check. They can set it up through credit or debit. They can use EFT options, but the billing date will be streamlined across the board. So when they're set up electronically, it comes out on the same date, and the date is escaping me, but it is all around the same date.
I believe
So
it's
you have both.
Nicole, the
Go ahead. 7th of the month? Okay.
I believe that's
Thanks,
when it
Jenny.
comes out. Mhm.
All right. Is it the 7th of the month prior or the current month's coverage? Hey, that's a great question, Courtney. I believe it is for the current month. I'll double check on that. January 7th.
Hey, Nicole.
Yeah,
Two that I'm noticing here that we might be missing. If you're running a quote, the network option will come up only for that area. Is that correct?
correct. That is
Okay.
correct. You're right, I missed that.
And then the pediatric dental and vision. Do the plans include that?
I believe that's mandated, isn't it? I want to say yes, it is. Let me validate, but I thought that those were mandated benefits for pediatrics. Did I miss any other questions?
I don't see any in there.
All right, let's see.
And Nicole, while you're looking for that, I just wanted to add, you can look at the PDF version of the Heartland Blue brochure. It's under the individual plans on the broker portal under nebraskablue.com. So if you look at those individual products, you can at least see that PDF while we're waiting to get that added to the order form for you.
Yep. Pediatric dental and vision coverage is covered under the plan. It's on page 24 of the brochure. It kind of outlines what type of services they do have. So yes, the answer to that question. Is it
Nicole,
subject to the deductible? It is subject to deductible and coinsurance.
Nicole, did you want to go over our standalone dental since it's not on the marketplace?
Yeah, individuals can still enroll in the standalone dental policies. Those plans are available. They are not on exchange. They are independent from the ACA coverage. So if they want a little bit more coverage beyond the pediatric dental care, they do have the ability to write a dental policy. Now, the link to submit an application or to get access to the application is on the BBP as well under ancillary benefits. We are looking at integrating that eventually into an enrollment platform. However, it is still a paper process. If you want, if your individuals want coverage and they enroll at the same time, we will waive the waiting period for B services. If they enroll at the same time with the same effective date, and the application for dental will be updated, that includes that question on there. Have they enrolled in an ACA plan? The billing could occur differently or separately from the ACA plans. But yes, to your point, Jenny, they are available, they're out there. And all of our links this year will be on the BBP for both over and under 65. So one bookmark this year, thank goodness. And that bookmark is for the BBP where you get your Armor Health information. All of our individual products will be on the BBP with buttons. All right. I'm not seeing any other questions. Did we miss any other questions?
Yes, Chip, this is being recorded. I don't think I see any other questions in there. If you guys do have any other questions, go ahead and send them over to individual sales and we can get them answered by ourselves or Blue Cross.
Absolutely. All right, I have a couple of small takeaways. I will respond especially on that broker bonus. And
Okay.
we are open if you guys have any questions for us as well. We appreciate your time today. You guys have a great selling season. It's going to be a fun year. There's lots of things going on, so enjoy.
Thanks, Nicole. Thanks, Jenny.
Hey, you're welcome. Thanks, you guys. You have a great day.
You
Thank
too.
you.
Bye-bye.